talking about cybersecurity in pharma, right? Now we understand security is important for every business, right? But what is the weightage for cybersecurity in the pharma industry, and what is the scale of it being one of the foundations of the business?
See, if you talk about pharma or if you talk of weightage, so
Right.
first thing I will clear that, as I mentioned earlier, nowadays cybersecurity is
Every
same level at everywhere.
right,
But then again, just to put as a pharma,
right,
why cybersecurity is more important, we can say is that because normally pharma, when we talk, it's a life science or anything who's manufacturing the drugs,
right.
it is directly related to a person's life.
Absolutely.
So if
Being more
something
critical.
happens here, the human life is on stake. Correct. If when we say ransomware attack,
Right.
correct, they may ask $2,000, $5,000, $20 lakh, whatsoever. It's money. It's a business. It's a brand. That is one part, and human is one part.
Right.
So for human, because if something happens here and if that data integrity has been stolen or made something by someone, integrity has maybe the compromised,
Right.
your total formulas will get troubled, and that particular medicine may get effective of something defects, and you may have a big issue of the people. Correct.
True.
That particular medicine and somebody has gone, and that various things that are different, all different together. So when we say about pharma earlier also, if we talk about FDA and all that things, there are very stringent norms
Correct.
by default, normal. Correct. It's not cybersecurity, but stringent norms are there.
True.
Why there are stringent norms? Because of this particular reason. If you talk about any pharma company, the environment in the your factory is also very important.
Correct.
What is the your humidity kitna and
Right.
temperature? What is
I
the
know, yes.
everything's are there. So and when we go into that particular factories also we have to follow various rules.
Protocols. Yeah.
So these are the things which make cyber security,
right.
that is same as information security,
Right.
for a pharma critical than any other industry. Because if you talk, if you say finance, so finance critical, but what? Money.
Right.
If the bank loot gaya, what has happened? Everybody money has gone.
Yeah.
Correct.
True.
But here what happened? The person are on stake.
Correct.
That is the difference. So it's very critical for this.
So even more importance, more
Human is there. No, after all, human lives are very important.
True. Now, what are the challenges in computing for the R&D departments of organizations such as yours?
Any organization, see that R&D when we talk,
Right.
this is same for everyone. So what happened mainly in R&D? Correct. So if we know that, then we can put why it is important, what we have to keep. R&D mainly what happened? There are two types of industry or two types of business. Correct.
Right.
When you say B2B, B2C, and all that things. So there are the IPs. There are the customer data.
Right.
We get from customer something. On that basis, we have to do something. Correct.
Correct.
And whenever we talk R&D, it is of 1 year, 18 months time frame. Any R&D you take.
Right.
It is not that we have taken today.
Yeah.
So if you want to do that for a year together, and then there are the multiple results, multiple steps are there, and we have to get that data. In each stage, it goes in the multiple, we can say the gates.
Sub-layers, yes.
So logical gates, I'm saying multiple logical gates. That data is here and there, and then people are changing. People are also changing. Because we can't say that person is there and he will wait for us for 5 years. Also, if we say that there will be some time in between, in some product he has gone, some of the project is going on and he left after 6 months, project is long. So all these things when we are talking, so main thing is your customer data and then your IP.
Okay.
If we say that we have to protect that first, here we can put various type of security. Here what happened, and one thing, as I already mentioned, when we talk about any type of cyber security, major thing is our internal threats, which are very important.
True.
Which actually need to take care of us. We are talking about bad guys, and we are talking about somebody from outside hacking.
Right.
But the study says, or the research says, near about 90% from internal.
So
Awareness. Mainly awareness. They are doing something, it is happening, and that goes into it. Correct?
Right.
and there may be 1 or 2 person who is disgruntled employee.
True.
So that is just 1%. So when we say 90% internal is just because of majorly for the awareness. So what we can do, if we talk about R&D or anything or anywhere it is applicable, but R&D is most,
right,
because it's more critical. So we have to educate the people, tell them what is the information security, what is the cyber security,
right,
what is the implication of this if something happens. So we have to explain them, and it is not once. We have to do that every time.
It's a very
every 6 months we have to train them, tell them what is happening. Also, as I mentioned earlier, there should be a mailer. We used to do this mailer, saying that if something happens somewhere, and if we read somewhere in the maybe in the newspaper or your digital paper, anything digital news, we have to spread that in the group, because everybody should know it has happened, so that they can learn from that. So this type of techniques we should use. And it is important everywhere. Earlier we used to say like, now I remember one more thing, going back, as you said about R&D, when we have done this project, information security project in my old company in 2011, first phase we have done for R&D.
Okay.
So at that time we say R&D is more important, others are not that important.
Right.
But today it is not true. R&D is, we can say, on the scale of 1 to 10, R&D may be 10, but others are
equally important.
9, we can say.
Right.
So it is not that ki nahi kiya to bhi chalega.
Right.
Because nowadays information is seamlessly flowing.
Correct.
It is nothing like R&D में जो data हुआ वो बाहर नहीं आ रहा है. Earlier used to happen. We said that, now what we used to do at that time, mobile also we said, mobile आप इधर ही रख दो, gate पे, and you go. All officers also, senior guys also.
अच्छा.
Mobile we were keeping on the gate for the R&D, so they should not take there, but they can take picture also and all that things. So, and then they used to take a mobile without camera. Nowadays there is no mobile without camera. And there is no life without a mobile. Both the things are there now. Now what to do? Then we have to do the thing like your cyber security, your applications, your knowledge, awareness, all that thing. So even if it is R&D, even if something, that is first thing is your awareness. Train the people, tell them the implications first.
Right.
Once they know that, they will not do, because the people are not bad. Various time unknowingly it is happening. So there we have to work with them.
So constant awareness is the key.
Constant awareness is the key. That's all.
True. Now, we all know pharma technology is of course very high-end technology, right? So what kind of revolutionizing technologies are in play currently in the pharma industry?
Actually, revolution is everywhere, but in pharma is too high, because when we say COVID, so only industry which has surged very well is the pharma.
It has done the best during COVID.
So what happened is that now in the pharma, like industry 4.0, there is also industry 4.0, which is termed as pharma 4.0.
Right.
So it is in place now. So the applications in the pharma, like when we talk about the laboratory information system, correct? Then the your documents for master controls, correct? Various thing of the revisions and all that things.
Right.
ERP is already there, and then the integration between these. Then there is something called lab notebook. So we just got as an electronic lab notebook now. But earlier they used to do that is a FDA norms. We have to keep everything. Now it has came as a ELN, electronic lab notebook.
Okay.
So that are in place now. Right. People are working on that, and these things like when we talk about the pharma 4.0, there when the factories are there, shop floors are there. As I mentioned you, they have got stringent norms of what is the temperature there, what is the humidity, and various other norms are there. So there, if that particular norms, that through sensors we have to catch, and if that is not in place, machine should not start, or any machine, anything is going on, it should stop. So this way it ensures that whatsoever you are writing down on paper and then getting it, before that through system it will take care.
Okay.
So it is 100% that whatsoever is coming up will be your best of it for that. Okay. So that are the things are already going on. You are all, earlier we used to say that chromatography and non-chromatography data, that is different data. Now people are working on integrating that. So whatsoever tools are there which are getting used in the laboratory system like wave balance and all that things. That integration is going on now. So that data should come directly. There should not be a human intervention.
Right.
That is
It
going
becomes
on.
more efficient also then.
Efficient also, and you will get. Then there are the predictive maintenance. Those very high in that. As I mentioned about the your temperatures and humidity and all. They are all controlled. So earlier they used to go and check. Now it is through sensors.
Correct.
So they used to get that data. Only exceptional data comes for that. So that way they are also growing up in that very heavily.
Well, thank you so much for sharing about IT landscape in the pharma industry. Thank you for that.